You're struggling with maternity, NCLEX review, nursing school content, then these are videos you want to watch. Straightforward, we're going through each concept associated with maternity using NCLEX practice questions with rational, veto, rational, but straightforward concept. Video number 4. Stick around and let's learn something. Question 1. What am I trying to teach you? APGAR score, you have to know how to calculate it. You got to be familiar. They are straightforward, but you have to know the component, right? APGAR, APGA, with the A is your appearance, and the P is your pulse. G is your Grimace, right? A is your activity. R is your respiratory rate. But what is the question am I asking? Which Grimace? This is the one always trick people. You easy to make a mistake about it. They don't tell you it's a reflex, but it's actually a reflex response will receive a score of 2. In the APGAR score, you get 0, or you get 1, or you get 2, a total of 10. That is the key. Which of these Grimace's signs will give the individual what? 2, showing good reflex. Look at it. If you cough, yeah, your glossopharyngeal, they're doing their job. If you wimpy, no way. Facial grimace, that means you're not moving that much. If you're sneezing, that require a lot of multiple cranial nerve with good reflexes. Crying, same thing. No response, of course, you get 0. But these are key facts they will put in a question, and I'm giving it to you. Pay attention, write about them. Grimaces, these are the easy one. The other one too is activity. That can also be tricky. Therefore, the content, what? You get 0 if you have no response. 1 if you have minimal response or you're whimpering. Or you have grimace, but it's just a facial grimace, only 1. You get 2 if you're very vigorous, you're coughing, you're sneezing, and you have a strong cry. Therefore, what do you think are the answer? Sneezing, get 1 point, 2 points. Crying, get 2 points. And cough, get 2 points. These are little things you have to know. I suggest you write them down. Question number 1, answered. NCLEX practice question, maternity NCLEX review. Next one. What am I trying to tell you? Concept. Like I said, every question has its own concept. What is the concept? Why do we give Rhogam? Because you have to teach the patient. What do you think? And what is the content? In another series, I will give you the indication for Rhogam, which client statement indicate correct understanding. A postpartum client receive education about Rhogam. What do you think? I receive Rhogam because what? So my baby's blood type won't be affected. Is that the reason why? I receive Rhogam to prevent my body from making antibodies against my baby's blood. Rhogam will cure me if I already had antibodies. I only need Rhogam if I have a miscarriage. These answers are all content-based. And like I said, these are straightforward but require some thinking. When do you give Rhogam? There is a concept associated with it. You usually give it either at 28 weeks or 72 hours after delivery. There's some situations where you have to give it. Either you have other conditions, right? Miscarriage, abortion, ectopic pregnancy, even if involving trauma, involving molar pregnancy. If they do an invasive procedure, like I said, I will set a question regarding that concept. But this is what the mother is saying. Put down your answer. Let me know what you think. Which answer choice do you think is the right one? Based on the content, what are we doing? We are preventing sensitization of the mother. That is the key. I only need it, only make you not to pick this answer choice. Miscarriage, you need it for more than that. If you have abortion, if you have a trauma, you have miscarriage, you will need Rhogam. It does not cure any antibodies that are already there. It cannot deal with it. We want to prevent you from making antibodies. The already antibodies that is already there, it cannot cure it. You're receiving the Rhogam to prevent, it's a prevention, sensitization of you making more antibodies. My body for making antibody. That sound more reasonable. It indicates what? Correct understanding. I receive Rhogam, so my baby's blood type won't be affected. It has nothing to do with your baby, it's you. The baby blood is going to be the same, but we don't want you to react with the baby's blood. Therefore, number 2 is your right answer. But this, I'm breaking down the question, show you test-taking strategy how to answer questions. Take your time, go for the keywords, the buzzword in the question, and break it down. Rhogam prevent maternal what? Sensitization to Rh positive fetal blood, preventing hemolytic disease in the future pregnancy. Therefore, number 2 is the right answer. Which statement by the client indicate further teaching is needed. Once again, stop the video, answer the question, then look at the way I'm going to approach it and master the style that I use to answer question. I want you to do that because it makes question answering easy. I read it from the back. And what did I do? I go for the buzzword, which statement by the client indicate what? Further teaching. I'm dealing with the further teaching. They're saying something bad. They're saying something wrong. Therefore, a postpartum client report what? Redness, buzzword, warmth, buzzword, tenderness, buzzword, were on the breast. A collection of these buzzwords tell me mommy has mastitis. Then bring your content. How do you answer questions on mastitis? Know your content regarding that. And based on what your content say, if they say something contradictory to what you know, you're going to think that that need further intervention or teaching. As you continue breastfeeding or pumping from the affected what? Breast. That means he said, keep on feeding the baby through that affected breast. I can take what? Warm compression to relieve what? Discomfort. What is she saying? Warm compression will release comfort. Number 3 said, I will stop breastfeeding until the infection has gone away. Number 4 said, report any fever or flu-like symptoms to the provider. The key is when you have mastitis. The concept is when you have mastitis. The maternity concept when you have mastitis is to keep on allowing breast flow, which answer choice improving breast flow. Number 1 said, keep on pumping and breastfeeding. You are allowing breast flow. Number 2, using warm compression will allow breast milk flow. 3 said, don't allow it. Stop it completely until the infection goes away. Infections never goes away if it's not coming out. And 4 said, if there's a signs of deep infection, fever, flu-like symptoms, I should let my doctor know. What do you think? Which one is a bad sign? You need to intervene. Mastitis is not the contraindication to breastfeeding. Continue to nurse or pump help clear the infection. Therefore, saying that I will stop breastfeeding until the infection completely resolves need further teaching. Number 4, what is this question about? It's a straightforward. I don't want you to overthink it. You look at the answer choices, said they look the same. What am I trying to teach you? NCLEX will set questions like that. Like I said, every question in your test has a concept they want to test. A client with preterm labor is prescribed what? Betamethasone, right? Steroid. Which order should the next question? That means they want you to know what is the steroid and what is being prescribed that you need to question. All of them said, administer something. And then there's different doses. And then there's the IM and then there's the IV. There's different times and different dose. They don't want you to know the dose, the frequency is irrelevant. The key is you can see the difference is the route. Of course, you have to know the route of this medication because it's an emergency medication used in what? In preterm labor. Now we got to give it to the patient as soon as possible. Therefore, what do you think? I see 3 IMs and I see IV. That is your clue. There's an odd answer choice in it. Don't make it difficult. There is an odd answer choice. I want you to know that this steroid given to improve surfactant in preterm labor is what given as IM medication. That's all. So the steroid medication, betamethasone, is given as IM, not IV. That's what I'm testing. That's the concept you should take with you. And then she's assisting with the shoulder dystocia delivery. What is the concept? Shoulder dystocia. This is the way the NCLEX asks question. One line, straightforward. There's no ambiguity. This is what I hear from my students, and that's how I set my question. Straightforward, one line. Assisting with shoulder dystocia. No 4 lines, no 5 lines. This is it. Therefore, which action should the nurse take? You have to know what shoulder dystocia is. Basically baby head come out, and then you go back. Total sign. It's because the shoulder is locked in place because the baby presentation is bad. If you present with the shoulder and there's a problem, we can deliver the baby now. What do you think? This is an emergency because remember, the head comes out and it goes in, and we have to do something quickly. The first thing you do is to time it. Like I said, these NCLEX practice questions are content review. I give you the content and you have to take notes so that you can use it in the form of giving you a long lecture. I give you everything you need to know. So the first thing is to know, you know the time. You call for help. Is to call for help. Note the time that it happened. Prevent the baby from retracting back by providing suprapubic pressure, not fundal pressure. Then perform Mark Robert, where the mommy knee is pushed to the abdomen, right? Or chest, right? You put it to the abdomen, and these allow you to be able to apply pressure simultaneously. And the doctor instruct the baby, the mommy, to do what they have to do to deliver the baby. We have shorter time. The longer it takes, we get into trouble. Therefore, what do we need to do? Suprapubic pressure and Mark Robert maneuver will help dislodge the shoulder. Forceful pulling of the head is not indicated. The mommy has to still push, but not a vigorous one. The baby may need resuscitation because we have just 5 minutes to deliver the baby. Therefore, prepare for neonatal resuscitation, perform Mark Robert, and apply suprapubic pressure. 3 and 4 are wrong answers. A postpartum client with the history of gestational diabetes. What is the buzzword? Gestational diabetes. I've given you a clue. Develop what? Excessive thirst. Buzzword, frequent urination. In a patient who have diabetes and have frequent urination and excessive thirst, bring your content. That is indicative of what? Excessive glucose, hyperglycemia. What do you want to do? Remember, hypoglycemic symptoms is like upper symptoms. You have tachycardia, diaphoresis, but these hyperglycemia symptoms, excessive taste and urination, will lead to dehydration. What do you want to do? Do you let them drink more water? Do you check your finger stick? Do you let the doctor know you are set for signs of postpartum infection? There's nothing in the question that tells you there's infection. I'm not giving any to you, tachycardia, or they complain about anything associated with infection, or they complain about test and what? Frequent urination, consistent with hyperglycemia. Patient has gestational diabetes. You got to confirm it. There's no emergency. If there's emergency, you treat it. But since there's no emergency, you got to investigate more to confirm before you treat it. How do you treat it? You don't let them drink fluid. You check their glucose level and figure out what is wrong with this patient. That is the test-taking strategy you have to employ. Excessive test and polyuria can indicate hyperglycemia. The next phase has to assess the blood glucose to confirm it before taking an action. A postpartum client, we are on number 7. Stop the video, count how many you got. You have 3 more. Redeem yourself if you're not doing well. But I know you watch Adapting Class, and I know you get 6 out of 6 already. I believe in you. Let's get to it. Number 7, a postpartum client is prescribed what? Methylergonovine for excessive urine what? Bleeding. Which assessment should the nurse perform before administering medication? Keyword, every time you see this medication, I know you know what to say. This causes vasoconstriction. Therefore, any condition that when you ensure vasoconstriction is going to worsen it, stroke, you should not take it. Heart problem, you should not take it. Hypertension, you should not take it. Therefore, what assessment would you do? Level of urinary tenderness is bleeding, but the question is not asking about bleeding. It's asking about what? Medication. This is how you can mix the point if you focus on wrong information in the question. The question says, prescribe what? Methylergonovine. And then the last portion said, assessment should be performed before giving what? Their medication. Their medication. Therefore, answer choice has to be related to the medication. Blood pressure measurement, assessment of local color is talking about the bleeding. I don't care about the bleeding. The medication will do its job, but I need to make sure it is safe to give you the medication. Assessment maternal temperature. Once again, it has nothing to do with the medication. Therefore, what do? Check our blood pressure. If it's normal, we give you the medication, and the medication can do it. This is the key. BP must be assessed before each dose. A client of 24 weeks gestation report frequent headache and dizziness, second trimester, and having headache and dizziness. That's a bad problem. You worry about complication during pregnancy. One of them is preeclampsia or gestational hypertension. What should the nurse do first? You check the patient blood pressure, let them rest, administer acetaminophen, and call the provider for referral. Figure out what is wrong. They were going to ask you, if you call the doctor and say, hey, what is the patient blood pressure? You give the acetaminophen. You think headache and associated dizziness. Headache should not, you use acetaminophen for headache that is isolated, just the headache. After you rule out bad stuff. Rest and hydration, you've done nothing. Therefore, let's check the patient blood pressure. Headache and dizziness can indicate preeclampsia. We should assess first to make sure there is no bad problem. A client, 18 weeks, right, beginning of his second trimester, report pelvic pressure and occasional sharp pain on one side of the abdomen, not two sides, but one side. It's an occasional. Then you ask yourself, what kind of things will cause pain during second trimester? If it's going to be ectopic pregnancy, I will tell you that. You'll see a clue. And what is the clue? Bleeding. There's no bleeding in the question. Don't bring anything in. If it's a miscarriage, there will be some bleeding. You see, it's just straightforward. When you see your question, don't add anything. I said pelvic pain and sharp pain, pelvic pressure and sharp pain on one side. I tell you, on one side of the abdomen, something is isolated to that side of the abdomen. This is normal, and due to ligament stretch, you should go to the hospital right now. Stop all activity until the pain resolves. This may be a sign of preterm labor. What do you know about preterm labor? Pain has to start from the back and go into the pelvis. I have to give you signs of consistent labor, regular contraction, some effacement, and there is nothing in the question telling you this is keep on going on. The word occasional defeats the purpose of preterm labor. Don't get trapped. And you know the answer. This is due to round ligament stretched. It's common during the second trimester. Therefore, teach them not to worry, but monitor it. If you continue associated with bleeding and cramping, yeah, you worry about the bad stuff, right? Preterm labor and other things. But this is common during the second trimester. And the last one, I know you get 10 out of 10. A client at 24 weeks gestation report vein on the leg becoming more prominent. You know your content. Pregnant lady, they're going to have engorged vein due to what? Maybe pushing on the IVC, inferior vena cava. What is the problem? This is the reason why you don't put the mommy on their back. You put them on their left side. Therefore, what advice would you give them? Avoid elevating your leg. Wear supporting stockings and avoid prolonged standing. Start vigorous exercise to improve circulation. This requires immediate surgery. What do you think? Think about it. Step back. I talk about vein. Bring your cardiology in. This is peripheral chronic venous disease. What kind of teaching do you provide to a patient with chronic venous disease? You know it. I know you know it. What do you think? The idea is to what? Prevent blood pooling into your leg. Therefore, number one is wrong. If you avoid elevating your leg, blood pool down, you have more engorgement. Stockings and avoid prolonged standing prevent blood pooling. Start vigorous exercise to improve circulation. It has nothing to do with that. It's due to blood pooling. Vigorous exercise is not going to affect the venous system, it's supposed to elevate it. This requires immediate surgery. It's expected finding, but we can do something about it. You don't need surgery. Therefore, varicose vein are common in pregnancy. Supporting stockings, leg elevations, avoiding prolonged standing help relieve symptoms. Therefore, number 2 is your right answer. 10 questions. NCLEX practice question. NCLEX answers, questions and answers. Maternity review. Reviewing every concept associated with maternity. Thank you for watching. Good luck in your exams.